If you're a Medicare beneficiary, you may have heard of the term donut hole. Unfortunately, the Medicare donut hole is not as sweet as the donut you eat for breakfast. Hi Medicare community, my name is Lindsay Engel. I'm the Medicare expert for Elite Insurance Partners and MedicareFAQ.com. Medicare Part D is the part of Medicare that covers your prescription drugs. Medicare Part D is available through either a standalone prescription drug plan or through a Medicare Advantage plan. These plans do renew and reset annually on January 1st. So, what is this donut hole term that you keep hearing thrown around? Well, it's one of the 4 phases of Medicare Part D. What many don't realize is that the Part D program is not funded by premiums, but it's funded mostly through the Medicare program. In order to keep the Part D program sustainable, Medicare had to find a way to convince beneficiaries to choose generic drugs over brand name drugs. That's why Medicare created the donut hole, also known as the coverage gap. When the donut hole was first created, or the coverage gap, beneficiaries had to pay 100% of the cost of their medications. In order to avoid the donut hole, beneficiaries would switch to the generic version of their brand name medications. However, not all medications have a generic version available. For those beneficiaries who could not find a generic version, it really put them in a financial bind. Thankfully, legislation had stepped in and reduced the amount from 100% down to 25%. Now that you know why the donut hole was created, let's go over the 4 phases of Medicare Part D. The first phase we're going to go over is the deductible phase. Part D plans come with an annual deductible. You pay the full cost of medications until you reach the annual deductible amount. Most beneficiaries don't realize that even though their plan does have a deductible listed, that if they're taking generic medications or Tier 1 and 2 medications, it's quite possible that the deductible will not apply to them. However, if you're taking a brand name medication that's Tier 3 or higher, then you'll likely have to pay the full cost of your medication until you reach the plan's deductible amount. The second phase is the initial coverage phase. After you've met your deductible, you are now in the initial coverage phase. While you're in the initial coverage phase, you only have to pay a set amount of coinsurance or copay that was set by your drug plan. How much you pay in coinsurance and copays will depend on what tier your prescriptions fall in. These tiers do vary from one drug plan to another. You can find these tiers in your plan's drug formulary. The initial coverage phase is where most beneficiaries end up staying until their plan renews at the beginning of the following year. Now, the third phase is the donut hole phase, also known as the coverage gap. What's important for beneficiaries to know is that most people do not ever reach the donut hole or the coverage gap. Around 85% of Medicare beneficiaries will end up staying in the initial coverage phase. You'll fall in the coverage gap after a certain spending amount reaches a set threshold. Once the total cost of your medication reaches the set threshold amount while in the initial coverage phase, you'll enter the donut hole, or the coverage gap. The total amount includes both what you pay for your medication as well as what your insurance pays for the medication. While in the donut hole, you'll have to pay 25% of the full cost of your medications for both generic and brand name drugs. The fourth and final phase of Medicare Part D is the catastrophic coverage phase. Once your true out-of-pocket cost, or your TROOP, reaches a certain amount, you'll reach the catastrophic coverage phase. While you're in the donut hole, what counts towards your true out-of-pocket costs includes the amount you paid towards your deductible, any copays or coinsurance you paid while in the initial coverage phase, and the full cost of brand name drugs while in the coverage gap or the donut hole, as well as the amount you paid for any generic medications while in the donut hole. Once you reach the catastrophic coverage phase, your cost for your medications will go down. In this phase, you'll only pay around 5% of the cost of your medications. Now that you understand the 4 phases of Medicare Part D, it's important to know that these plans do change annually. That's why during the annual enrollment period, which runs October 15th through December 7th, you want to compare all the plans available to you in your area to make sure you're always saving the most amount of money. Thank you so much for taking time to watch our video today. We hope you found it helpful. If you have any questions regarding the Part D coverage phases or Medicare at all, make sure to post them below. We'll answer as soon as we can. If you haven't already subscribed to our YouTube channel, make sure to do so today. Make sure notifications are turned on so you're notified every time we post a new video. We also have a fantastic Medicare community on Facebook. We'll make sure to include a link in the description below so that you can join. Until next time, bye!